2022 is a pivotal year for Gillette. We are celebrating 125 years of serving patients who have brain, bone, and movement conditions, their families, and our community. We continue to fulfill our mission of serving our patients as the coronavirus pandemic enters its third year. While we will take time this year to come together to recognize and honor our history, we are also planning for a future that will allow us to continue expanding our reach, serving more patients and families, and contributing to improving care modalities. However, nothing we've achieved in our past or present would have been possible without the dedication of our team members, and that commitment to providing world-class, compassionate care is foundational to Gillette's history. Our history doesn't start with a building or a clinical breakthrough. It starts with Royal Gray, a young boy with Pott's disease whose parents were desperate for answers. Then they found their champion in Dr. Arthur Gillette. Dr. Gillette promised the Grays that he would provide the best medical care possible to Royal. That promise is a cornerstone of Gillette's mission. Since our founding in 1897, Gillette grew, serving more patients and moving to a larger facility on Lake Phelan in 1915. 10 years later, we opened our brace shop, the forerunner of Gillette's current orthotics, prosthetics, and seating department. Beginning in the 1930s, as the tuberculosis crisis quieted, and then for almost 3 decades, Gillette responded to the annual polio epidemic, caring for hundreds of hospitalized children at a time, while vaccination efforts struggled to control various strains of poliovirus. Amidst the polio crisis, the team advanced many clinical discoveries, including a scoliosis treatment program, bringing additional global attention to Gillette's unique skill set. We continue to expand and move to an even larger facility and our current location in the mid-1970s. In our new home, we established a gait and motion analysis lab, the first accredited center of its kind in the United States. In 2009, we began providing dedicated intensive care services and related support programs. This included an enduring collaboration with Regents Hospital to open St. Paul's first Level 1 pediatric trauma program. In current day, our drive to innovate has led to great things such as pioneering surgical procedures and new medical devices, conducting clinical trials of new therapeutics, using simulations and 3D printing technologies for training and teaching, launching a healthcare press focused on complex care conditions, disabilities, and traumatic injuries, and expanding access outside of traditional clinical facilities into virtual settings and patient homes. As we reflect on these and other historic milestones, it is clear that we relentlessly pursue innovative solutions, improve care, develop new treatments and therapies, and conduct useful, best-in-class research, all with our patients at the center. This path hasn't been without challenges. In 2020, the coronavirus pandemic brought distinct hardships into our work. But with the steadfast dedication of our staff, particularly our clinical and clinical support teams, Gillette Children was and is able to provide high-quality care. It is this commitment that drives Gillette to continue innovating into our future. The vision, dedication, and perseverance of our physicians, staff, and leadership teams translated into a strong year for our organization. In 2021, amid a global pandemic, we treated more than 26,000 patients. Our patients came from all of Minnesota's 87 counties, 44 U.S. states, and 5 different countries. Through digital health programs, we completed over 11,500 medical and rehab therapy virtual visits. Our virtual rehabilitation program was recognized by the International Hospital Federation and the World Health Organization. We continue to lead the marketplace in volume and outcomes for orthopedic procedures and interventions, including a preeminent spine program and new work in orthopedic rare diseases. Our gait and motion analysis lab remains one of the busiest in the world, with 46% of our patients coming from other states or countries. In neurosciences and physical medicine, we offer the most comprehensive program in the marketplace, working not just to rehabilitate, but to habilitate with a palliative focus for our patients, from early childhood into young adulthood. Our research continues to make a difference in the lives of our patients near and far. This past year resulted in 140 active research studies, over 75 peer-reviewed published articles, and 54 externally funded projects. And the Gillette Children's Foundation raised over $10.5 million. Our resolve and dedication are built upon a strong mission, empowered by expert teams across nearly 50 departments. Our perseverance is part of our bold vision for the future. We see a future where Gillette's impact expands, serving children and advising their care options for their rare, complex, or disabling condition that began during childhood. Children from across our region, country, and the world. Because the challenges of these conditions are social as well as medical, we will influence U.S. and foreign policymakers to promote opportunities for individuals living with the conditions that we specialize in. We are modern-day, team-oriented clinical leaders. Together, we see potential when others look away. Our team members bring all their knowledge and skill to opening minds to new possibilities for every child in our care and to children who we can impact through our research and advocacy. If a solution does not exist, we create it. If a question is unanswered, we seek to find an answer. Every day, we push boundaries forward to transform lives. Together, we can tell our story of yesterday and today and define our tomorrow. We will do this by advancing quality and safety, focusing on our staff and our patients, stewarding our resources, delivering the best outcomes possible, and engaging in bold advocacy.